Good morning, Doc Scenario. Today, let's discuss opioid use disorder in detail. To start, can you define what opioid use disorder is?
Good morning, Dr. Tony. Opioid use disorder is a condition in which a person's use of opioids becomes uncontrollable, making it difficult to stop or reduce usage despite harmful consequences. It is characterized by an intense craving for opioids, increased tolerance, and withdrawal symptoms when the drug is not taken.
Correct. Opioids include both prescribed and illicit drugs, such as codeine, fentanyl, morphine, pethidine, tramadol, oxycodone, and heroin. These substances are commonly abused and can lead to addiction. Now, what are the immediate effects seen in someone using opioids?
The immediate signs and symptoms of opioid use include euphoria, confusion, increased sleepiness, nausea, constipation, pinpoint pupils, decreased pain sensation.
Well stated. However, as opioid use continues, dependence develops, leading to withdrawal symptoms when the person tries to stop. Can you list these withdrawal symptoms?
Yes, opioid withdrawal symptoms include abdominal cramps, uncontrollable cravings, agitation, diarrhea, anxiety, increased blood pressure, dilated pupils, sweating, sneezing, muscle pain, runny nose, tearing, goosebumps, trouble falling asleep.
That is correct. Opioid withdrawal can be very uncomfortable and, in severe cases, even dangerous. Now, what are the key signs and symptoms of opioid overdose?
Opioid overdose presents with the following signs: slow heart rate, bradycardia, low blood pressure, hypotension, pinpoint pupils, slow or shallow breathing, hypoventilation, unsteady gait, slurred speech, gasping, gurgling, or snoring sounds, sedation or coma. The symptoms of overdose include inability to wake up despite noise or pain, blue lips and fingernails due to lack of oxygen, slow breathing, less than one breath every 5 seconds, choking sounds, loss of consciousness, vomiting, pale face, body weakness or tiredness.
Excellent. Opioid overdose is a medical emergency that requires immediate intervention. Before we discuss management, what are the long-term effects of opioid use?
Long-term opioid use leads to 1. Continued use despite physical or psychological health problems. 2. Social and interpersonal consequences. 3. Avoidance of social and recreational activities. 4. Difficulty fulfilling work and family responsibilities. 5. Spending excessive time finding, using, or recovering from opioid use. 6. Increased tolerance, leading to higher drug intake. 7. Chronic fatigue syndrome.
Well explained. To confirm opioid use disorder, what investigations would you request?
Investigations include opioid risk tool to assess risk of opioid dependence, brief screener for alcohol, tobacco, and other drugs to evaluate substance use, functional analysis to understand triggers for opioid use, drugs of abuse panel DOA6 to detect opioids in urine, full blood count to check for infections or anemia, liver function tests to assess liver damage from prolonged substance use, kidney function tests to evaluate renal health, HIV and syphilis testing to screen for coexisting infections.
Good. Now, let's move to management. The treatment of opioid addiction has 3 main goals. 1. Stop or reduce opioid use. 2. Reduce harm related to drug use. 3. Help the patient regain functional life in their family, work, and society. How do we manage opioid withdrawal symptoms?
We use non-opioid based detoxification, which involves medications to relieve withdrawal symptoms. 1. For adrenergic symptoms, dilated pupils, runny nose, excessive tearing, clonidine, alpha-adrenergic agonist, tapered dosage, 300 micrograms 4 times daily for 3 days, 150 micrograms 3 times daily for 3 days, 75 micrograms twice daily for 3 days. Important, blood pressure monitoring is mandatory. 2. For anxiety and insomnia, diazepam, benzodiazepine, tapered dosage, 10 mg 4 times daily for 3 days, 10 mg 3 times daily for 3 days, 10 mg twice daily for 3 days, 10 mg once daily for 3 days. 3. For nausea and vomiting, metoclopramide 10 mg is needed. 4. For fever, chills, and pain, ibuprofen 400 mg is needed. Paracetamol 1 gram is needed. 5. For abdominal cramps, hyoscine butylbromide 10 mg is needed. 6. For rapid heartbeat and palpitations, propranolol 40 mg is needed. 7. For muscle spasms, baclofen is needed. 8. For diarrhea, loperamide hydrochloride 2 mg is needed. 9. For dehydration due to vomiting and diarrhea, oral or intravenous fluids, oral rehydration salts or normal saline. 10. For psychiatric comorbidities such as depression, imipramine, tricyclic antidepressant, fluoxetine, selective serotonin reuptake inhibitor.
Well done, Doc Scenario. What if opioid-based detoxification is needed?
If opioid-based detoxification is required, the patient should be referred to a specialist. In cases of opioid overdose, we administer naloxone at 2 mg per injection or auto-injector to reverse opioid effects.
Good. Now, what is the long-term pharmacological treatment?
Long-term management includes naltrexone, which is used to prevent relapse. The patient must be opioid-free for at least 72 hours before starting naltrexone. Initial dose, 25 mg. Observe for 1 hour for withdrawal symptoms. If withdrawal symptoms occur, stop the medication, manage withdrawals, and restart naltrexone after 7 days.
Excellent. Besides medication, what non-pharmacological interventions can help the patient maintain sobriety?
Non-pharmacological interventions include brief intervention addiction counseling, cognitive behavioral therapy, motivational interviewing, common elements treatment approach, group therapy, Alcoholics Anonymous, the 12-step program, Opioid Anonymous Group Family Therapy Rehabilitation Programs.
That was an outstanding discussion, Doc Scenario. You have covered opioid use disorder comprehensively. Next time, we will explore another substance use disorder. Keep up the good work.
Thank you, Dr. Tony. I look forward to our next discussion.